I'm happy that we gathered here to document experiences from those who were involved in the field, actually, those who responded to our call. And we're also happy that a number of international organizations, World Health Organization and others, came to our aid.
This was really an excellent moment for people who want to debrief properly in a very systematic way, but also to recount the lessons they have learned so that in the future we can respond better. This provided opportunity to hear from the responders themselves, the ones who are hands-on, the people who will build capacity.
We were the first people who went there, and that was a time when there was a lot of deaths, there were few human resources. The local people were not accepting still that this is an Ebola epidemic.
When we went, the health system was really down.
When we arrived in Freetown, Sierra Leone, we stayed like for 2 weeks waiting to be trained at home, sleep, eat, wake up, do nothing.
When we reached in Liberia, patients were flooding like water on the streets, in their homes, in the community, everywhere. There was no help at all.
I thought what was happening in West Africa could easily happen to my country.
In Uganda, I fought Ebola 5 times, and then the 6th time was in Monrovia.
So it's kind of timely, accurate, adequate communication to local, national, and EAC. So somewhere there should be.
You start exactly
In case of anything, we are ready. But before, we were not ready. So preparedness is number one thing.
We can succeed in the management of the Ebola when you are working together as a team.
It was really very enthusiastic. Everybody participated actively. In fact, time was not enough. 3 days you wouldn't imagine will not be enough for such a meeting.
This should not be the only conference. We should have regular forums, or there should be a way of sharing experiences.
Right from after this conference, the recommendations from here will go to our technical working group, which is a structure that is already established. And from the technical working group, these recommendations will go through the Secretariat Council of Ministers of Health and then to the full council.